Thank you. Good afternoon, ladies and gentlemen. First of all, I would like to mention to the public the launch of the Nigeria UN COVID-19 Basket Fund, which happened this morning. This is an initiative set up by the UN system together with multi-sectoral partners as well as the private sector. The plan is to have a specific fund for donations from the UN system as well as from international donors. The fund will be used to procure commodities, including ventilators, things that generally at the moment are proving very difficult to acquire through the normal routes. The UN system has the advantage of having reach, being able to negotiate with national governments. To this end, they've already put in $1.4 million US, I believe, so far, with commodities coming in over this week, including about 50 ventilators. I must re-emphasize that this fund is completely independent of government. No money will come to the Presidential Task Force or to the federal government. The donations will be in kind, and that's what we are encouraging other sectors to please do. Secondly, I wanted to inform the public that we have intensified our extensive distribution of COVID-19 awareness materials across the states and local media, as well as community networks. The general goal is to ensure that every Nigerian has access to life-saving information about the spread, control, and treatment of coronavirus infection. We must also dispel the notion that COVID-19 is an elitist disease. It is not. It has no respect for persons, regardless of your age, regardless of your position in society. In terms of the lockdown, as the Secretary to the Government of the Federation said, currently we have lockdown processes in place for Lagos, Abuja, and Ogun. We expect the public to please adhere strictly to the lockdown protocols. We have been reviewing this regularly together with the security agencies, and I cannot emphasize enough when I say, please stay home, stay home, stay home. It will protect you. It's even more important to draw attention to the need for people who have a higher susceptibility to severe infection, like our elderly, people above the age of 60, 70, those with comorbidities like diabetes, hypertension, those with uncontrolled viral HIV infection. These groups are the ones that are most likely, when they pick up COVID, to end up in hospital and probably on a ventilator and possibly dying. So these groups in particular really need to protect themselves by keeping away from general public. The DG NCDC last week had a query about testing, particularly as it relates to VIP. Again, I would like to remind the public that there are only 3 indications for testing for COVID. You need to have symptoms, which may be a fever, which happens in the majority of cases, up to 90%, a cough, which happens in 2/3 of cases, and shortness of breath in 1/3. If you have these symptoms and you've come from abroad, you've recently traveled from abroad, returned, or you've had contact with a case of coronavirus disease, or you have presented to a hospital with a respiratory illness consistent with the symptoms, we will test you. But regardless of your position in society, if you do not have these symptoms, we will not test you, because the negative test does not have any value. This is not HIV infection where you want to know your status. This is an acute respiratory infection. And the test we do is looking for the active virus itself. We are not looking for antibody status. So I'm urging the public to please understand with us, because from now on we will be adhering strictly to our protocol for testing. Exempted companies in terms of the lockdown, I wanted to provide additional feedback or clarity. When we talk about agriculture, we mean livestock and animal feed companies. These are all exempted from, they are exempted businesses that can operate during the lockdown because they continue to be a major component of our agri sector. I would also like to appeal from the state side, state coordination side, I would like to appeal to our state chief executives. The Presidential Task Force has, one of the decisions we took last week was to urge states, particularly state governors, to make sure they have isolation facilities with at least 300 beds in their localities. At least 300-bed isolation facilities. Preferably, these facilities should be linked to existing infectious disease hospitals or medical centers, because it's easier after the pandemic to then make use of these facilities. But I'm appealing to state governors to please make sure that they have isolation facilities of at least 300 beds at the moment, while we await what happens in terms of the progress of the epidemic. Hopefully, we may not use them, but if we need to use them, we need to be prepared. Finally, I would like to acknowledge our private sectors and donor partners on behalf of the Presidential Task Force, and in particular, patriotic Nigerian medical professionals who continue to work tirelessly with our health officials, as well as hard-working Nigerians providing essential services and the volunteer community. Our collective efforts are critical in helping to arrest the spread of this virus. Thank you very much.